Hi, I'm Corey. I'm a physical therapist with Ried Physical Therapy, and I'm here to talk about what prehab is and why it might be important for you, and why I believe it's a lot of times the best option. So prehab is a term that we use for the physical therapy that occurs prior to taking on orthopedic surgery. So things like joint replacements, ligament repairs, tendon repairs, rotator cuff stuff, any of these big time surgeries that we're getting. A lot of times, initiating physical therapy care prior to having that surgery can lead to better outcomes. What we do in prehab is we work on improving movement, flexibility, and strength before you undergo one of those major surgeries. And what we see and what research will show you is that going through that kind of program prior to taking on that kind of intervention, those really big time surgeries lead to shorter versions of that first phase of rehab, that real painful phase, that really debilitated phase where you're allowing tissues to heal up. That phase shortens, and rehab in general to get back to full participation activity in sports and things like that shortens as well. It also makes that first step a lot more tolerable. So going through strengthening allows for decreased loss of function while you're recovering from the surgery. A physical therapist can assess for any deficits in strength, stability, range of motion, balance, or anything else that might be affecting function around the joint or body part that's being operated on, and can take a whole body approach to help recovery a little bit, recovery happen a little bit smoother. The biggest thing that I tend to see with people that are having rehabilitation is that they tend to tolerate that surgery a little bit better and come out a little bit happier with what's going on the backside whenever that surgery happens. And that rehabilitative phase tends to be a little bit more tolerable for them. So prehab is definitely something to help you physically and mentally prepare for that surgery that's coming up, and help you get to that next phase a little bit quicker and get back to doing the things that you like a little bit quicker following that surgery. So the best way to help make sure that your surgery and your post-operative rehab are successful is to take on some rehabilitation or prehab before you start undergoing surgery to kind of begin the strengthening process and begin that recovery even before the surgery takes place. Make things a little bit easier on yourself.